Welcome to the AARDY.compare.com YouTube channel for travel tips. I'm Jonathan Breeze, the CEO, and today's topic, China Travel Health. Well, at AARDY Compare, we look at a variety of different information sources in order to get a better view of a country and its health systems. Two of our preferred choices are CDC and US State Department, and here's their advice. So vaccines and medicines. All travellers should be up to date on routine vaccinations whilst travelling to any destination. Now, some vaccines may also be required for specific countries. Now, so make sure you are up to date on routine vaccines before every trip. And depending on your destination, your doctor may also suggest vaccinations for the following. Hepatitis A. Well, the CDC recommends this vaccine because you can get hepatitis A through contaminated food or water in China, regardless of where you are eating or staying. Typhoid. You can get typhoid through contaminated food or water in China. The CDC recommends this vaccine for most travellers, especially if you're staying with friends or relatives, visiting small cities or rural areas, or if you're an adventurous eater. Ask your doctor what vaccines and medicines you need based on where you're going, how long you're staying, and what you'll be doing, and if you're travelling from a country other than the US. Then we have hepatitis B. You can get hepatitis B through sexual contact, contaminated needles, and blood products. So CDC recommends this vaccine if you might have sex with a new partner, get a tattoo or piercing, or have any medical procedures. Then we move on to rabies. Although rabies can be found in dogs, bats, and other mammals in China, it is not a major risk to most travellers. CDC recommends this vaccine only for travellers involved in outdoor or other activities in remote areas that puts them at risk for animal bites, so such as adventure travel and caving. For people who will be working with or around animals, such as veterinarians, wildlife professionals, and researchers, people who are taking a long trip or moving to remote areas in China, and children, because they do tend to play with animals and might not report bites, and are more likely to have animal bites on their head and neck. Then we move on to yellow fever. Now, there is no risk of yellow fever in China. The government of China requires proof of yellow fever vaccination only if you are arriving from a country with risk of yellow fever. This does not include the US. Then malaria. So when travelling in China, you should avoid mosquito bites to prevent malaria. You may need to take prescription medication before, during, and after your trip to prevent malaria, depending on your travel plans, such as where you're going. So when you're traveling, and if you're spending a lot of time outdoors or sleeping outside, talk to your doctor about how you can prevent malaria whilst traveling. Now, the standards of medical care in China are not equivalent to those in the US. Hospitals in major Chinese cities often have VIP wards, which are fairly modern and typically staffed with well-trained English-speaking doctors and nurses. However, even in these VIP foreigner wards, English-speaking patients frequently encounter difficulty due to cultural, language, and regulatory differences. And finally, we would recommend to all travellers take travel insurance with you as a priority. You can get a best value from AARDY Compare and source all of the major US travel insurance providers in one place. Take care and safe travels.